I'm Tal Geva, Chair of the Department of Cardiology at Boston Children's Hospital and the Alexander S. Nadas Professor of Pediatrics at Harvard Medical School.
I'm Doff McElhinney. I'm an interventional cardiologist specializing in pediatric and adult congenital interventions at Stanford University, and I'm a member of the writing committee.
Can you please describe the current indications and results of transcatheter pulmonary valve replacement, and what is your perspective on the choice between surgical and transcatheter pulmonary valve?
The current state-of-the-art indications for transcatheter pulmonary valve replacement, it's really always in motion because there's new technology and a sort of growing understanding of the outcomes of these procedures all the time. So we're constantly learning more. But I think it's generally sort of accepted, in 2024, that transcatheter pulmonary valve replacement is a suitable option for surgical replacement in most circumstances. Occasionally, there's an indication for surgery that can't be addressed as a catheter procedure, or there are other circumstances that make patients either not a good surgical candidate or not as good a transcatheter valve candidate that might favor one or the other. But I think it's becoming more and more accepted that a catheter valve is pretty much comparable to a surgical valve, and that patient considerations, preferences, for whatever reason, sort of factor high in the decision-making process. Results, again, many of these procedures, we're looking at very long-term results as sort of the critical results, and that just takes time. In terms of the choice between surgical and transcatheter valve therapy, it's really a consideration that should be made in terms of lifetime management. It's not necessarily just what's best for this patient today, but also what's going to be best for this patient in the course of their next, 30 or 40 or 50 or however many years of life, and whether a catheter valve sets them up better for the future, or a surgical valve now followed by a catheter valve in the future might be a more appropriate option. I think we generally consider that, patients are going to need multiple additional valves in the course of their lifetime. So what we do today is not relevant just for their current status, but also for future options. So it's really an area where I think there has to be this paradigm of collaboration between cardiologists, interventional cardiologists, and surgeons to try to help determine what the best option is, period. From my perspective, though, there aren't a lot of downsides to catheter valve replacement relative to surgical valve replacement in general. In specific circumstances, there may be, but in general, catheter valves do what they're supposed to do. They provide a competent valve without obstruction. They allow the right ventricle to remodel, and they help patients become less symptomatic, improve their functional status, their quality of life in a manner that seems to be comparable to surgical valves.